Dr. London is calling.
Hello, welcome back to Student Dr. London Calling. If you haven't already, push that subscribe button so you can stay up to date on all the videos that will be posted. Videos drop every other Friday, 12 p.m. Eastern, 11 a.m. Central Time. So today's topic is going to talk about the pharmacology aspect. I decided to call up Dr. Butts. She is so amazing, so awesome. Just listening to her speak, I learned so much, just not only as a medical student, but as a future doctor. And it really just showed the importance of a village and how it takes a team to take care of a patient and deliver the best care possible. So without further ado, here's Dr. Butts.
Hi, my name is Ashley Butts, and I am an ambulatory care pharmacist. So what are pharmacists? Pharmacists are medically trained professionals that are technically considered drug experts. So we learn more about how drugs not only interact with our body, but also how our body reacts to the drugs. So essentially, we're drug experts. The benefits of being a pharmacist is that certain types of information, such as mechanism of action, such as bioavailability, how the drug is broken down metabolism-wise, that type of information is going to come from your pharmacist and not necessarily from your healthcare provider. The great thing about being a pharmacist is that you're not stuck to one realm. For example, I am an ambulatory care pharmacist, so I specialize mostly in chronic disease state management. But there is a variety of professions and specializations that pharmacists can be, such as infectious diseases. We also have our community or our dispensing pharmacists that actually dispense the medications you do receive. We also have internal medicine or acute care pharmacists for those inpatient hospitalized systems. We also have pharmacists that work on an industry-based level. So they're actually into drug development. They specialize in one disease state and try to actually develop drugs and medications for that particular disease state. Then we also have academia. So those people that want to teach other pharmacists or teach nurses or teach other professionals such as doctors about drugs and their characteristics, they go into that realm as well. So there are a lot of opportunities for positions or job careers with just being a pharmacist. Training that we actually go through is about 4 years of doctorate level training. And throughout these 4 years, so you're classified as a P1, P2, P3, P4. P1 through 3 is normally your didactic learning. So you're getting that basic knowledge, that anatomy and physiology, that medicinal chemistry, everything you need to build a good foundation to being a pharmacist. Between P2 and P3 years, you're actually trying to integrate what you've learned from those foundation classes into your therapeutic classes. So how does what I know about the anatomy of the body apply to the diseases that these parts of the bodies have? So I'm able to connect what I learned from my P1 year and P2 year into my P2 and P3 year. And then I'm not only looking at just one part of the body, but we're learning about looking at the patient as a whole. So I'm looking at all their systems, all their problems, and trying to find a medication regimen that tailors to them. The great thing about being a pharmacist in this day and age is that a lot of them do require a PharmD or a doctorate of pharmacy. Previously, you only needed a bachelor's of pharmacy or an associate's in pharmacy to become a pharmacist. However, our role has expanded so much, we do have a requirement to be a doctorate of pharmacy now. What that entails is that you're not only just a dispensing pharmacist or a compounding pharmacist to make the drugs, you're actually that health liaison to the patient and to providers about information of drugs they do not know or they do not remember. We're everyone's drug expert, right? So after your P1 through 3 year, you're pretty much done with your didactic learning in the classroom, and then you go on your APPEs. So these are your advanced practice experiences where you're able to apply what you've learned to actual patient care in different settings. Like a pharmacist, the main thing I want to stress is that we are on the same team as all healthcare providers, as all healthcare professionals, and we are just here to provide extra expertise on the drugs, medications, and we're here to help you. So your pharmacist is actually your number one liaison when it comes to medications, because any type of questions you may have, we are there to help you, whether it's about side effects, whether you weren't able to ask certain questions to your doctor or your provider. That's what we're here for. That's literally our job. And while we may not have the time during a busy, a busy retail pharmacy settings, there are always opportunities for you to talk to your friendly neighborhood pharmacists, to people you may know that are pharmacists or work in pharmacy. And don't be afraid to come back at a time when the pharmacy isn't as busy. Going back to tying all this training together, we're as pharmacists, we are taught to look at the patient as a whole, and we do practice what we call patient-centered medication regimens, as well as individualized patient care. So what medication may work for you, it's not going to work for everyone. The side effects you experience may not be experienced by your children or by your spouse or those around you. So it's very important that when we look into drugs and talking about how they may help or harm someone, we cannot compare our individualized experiences to someone else's. And I think that's one of the leading things that's been harmful with not just with immunizations and vaccinations, but just with drugs across the board. We have a lot of people that are just trying to speak their piece and speak on their experiences, and however they're creating that unwarranted bias because they're not realizing that what you go through or what you experience is not going to be what everyone experiences. Our bodies work in complex ways, in many different ways, and that's why we do have a variety of medications. The thing that I do want to encourage everyone to do is that when it comes to medications, be privy to doing your own research, because again, the body and the way it works in medications is always going to be different than someone else's. We try to practice individualized patient-centered care. However, it does help us when we know, okay, what allergies have you had, what reactions have you had, what side effects are you just completely against having, because side effects do subside, or they should subside between 2 to 4 weeks, depending on the medication. And we do know that there are some side effects that are worse than others, and some that you just don't want to live with, and that's okay. Talk to your pharmacist about them so that way they can help you suggest other options towards your provider. So you're not, damaging your health, or you're not to get the care you need without having to compromise. Like, we're trying to promote concordance, where we all work on one page and one accord to help you in any way that you may need it. I am somewhat of a content creator when it comes to Instagram, YouTube, or TikTok, and it comes to medications. However, we are living in a generation or at a time where society is privy on, instant gratification, instant information. However, take that extra time to go further into research. So look into articles, look into clinical trials, and see what has happened. Look at the populations of those clinical trials and those studies, because numbers can sometimes be misconstrued due to the patient population not even applying to you, due to not applying to your country. And there can times be a lot of gimmicks. They either want you to try another drug or to keep you from trying a drug. And so it just is really important to do your own research and not just take what you see on the internet or what you see on TikTok as face value. It does help to put in the extra work, because once you make that informed decision, you get that informed consent, you give that informed consent to your provider, you're able to actually put yourself on a better path to health, because you know that you did everything in your power to make sure that you're getting the drug you think is going to fit you and your disease state the most. Now, because my school was osteopathic, we did always like to preach, health and wellness on the body level. We want the body to heal itself first. Let's do anything we can that's more natural or more over the counter before going to prescription drugs. However, we recognize there are some disease states that cannot just have natural supplementation as a means for curing the diseases. This is not to say that natural supplements do not work. However, they are just that, supplements. Westernized medicine, we know there's a big stigma surrounding big pharma and certain companies wanting people to stay sick in order to take their money. However, for healthcare providers that do have a heart and got into this profession for the right reason, we are giving you the facts. We're giving you the statistics, everything that we see from clinical trials, as well as our firsthand experience with other patients when we do provide you that information you ask for or you need. So I don't want you guys to feel defensive or feel like you can't talk to your pharmacist or your doctors, because we are trying to help you at the end of the day. And if you do have a provider that you feel like is not listening to your needs, your wants, or not trying to help you reach your goals, then it is time to seek other options. Get that second opinion. And I encourage everyone to look into ZocDoc. Look at those reviews. Look into Google reviews. See what other patients are saying about these providers. See what their colleagues are saying about these providers, in order to help you pick someone that you think is going to, one, not only have the clinical knowledge to help in your situation, but also have the empathy they need to feel your situation and give you the best medication regimen that fits your lifestyle, fits your overall goals, and then fits you as a person, because you are not just a subject, you are a patient. So one might ask, when do I need to ask my pharmacist a question versus my provider a question, right? So in terms of medication, anytime you have medication-related questions, such as, is this a side effect of this medication? If I have this allergy, can I take this medication? How often can I leave this medication out? How do I store it? How do I take it? Are there any food allergies or restrictions? So all these questions are great questions to ask your pharmacist. You can also ask them to your provider. However, if your provider is unsure, your pharmacist is able to tell you, and not just from remembering what they learned in school, but by reading the medication package insert. And all these questions will be answered right there, and they're fully readily available for you. If you find yourself taking medication that doesn't necessarily give you the effect you want to see within the first week or two after taking it, it'd be time to ask your provider, okay, is this medication working? How exactly am I supposed to know that it's working? What am I supposed to feel like? Those are going to be things you want to bring up with your provider. And then also feel free to tell the truth in terms of how you're feeling, whether that's mentally or physically, so that way they can tailor it to find you a better medication choice for you. Again, we have all these medications in these different classes that do wonderful things. And there's not to say that one is better than the other, because again, medication is individualized. How it works in you is not going to be how it works in every single patient. And the more information you give your pharmacist and your provider, the more you increase our ability to tailor your medication regimen specifically to you, so that way we can accomplish those health goals that you want to achieve. And that could be anything from not wanting to take a pill every day to not wanting to take 3 pills every day. Because we do have combination medications. We do have pill packing where we can actually make the pills for you and you just take them on and go. We do have medication boxes to keep you on track with your medication. So there are a lot of devices and things that pharmacists and providers use to help you accomplish your goals. And it all starts with a conversation. So just being comfortable enough to talk to your pharmacist and your provider, having that communication and that boundary set to where you're able to talk to them about any and everything concerning your health and your medications is always going to be the first step. And I know there's some stigma about how like people such as pharmacists or other doctors believe in, big pharma and trying to keep you sick to keep your money. However, that is not a big reason why a lot of us get into this field. For example, I am from a very small town, Millersville, Georgia, and I just noticed that every time I went to the pharmacy or every time I talked to someone that was on several medications, they did not feel comfortable talking to their pharmacist. So when I went into these pharmacies, I realized that a lot of pharmacies or pharmacists where I'm from, we only have about 3 pharmacies in my area. They were not of African American descent, and they were not women. So it's like you're not gonna feel comfortable talking to someone about your health when they don't even share common characteristics with you. So I decided to be the change I wanted to see. I truly enjoy it. I love it so much that not only did I become a resident after completing my training, I did extra training to get more, build my clinical skills, but I'm also a current fellow. So I'm a clinical pharmacy education fellow, meaning I am also teaching pharmacy students with the hopes that at the end of this year, I will be teaching pharmacy students. I will be applying for assistant professor positions at different pharmacy schools. So once you find something that you're interested in, you really like, and you can see yourself doing it for long term, it will not feel like a job. You will feel like you're gaining so much insight, so much knowledge, and I've gained so many connections just from my pharmacy network, my nurse practitioner network, my doctor network. Like, I've met some amazing people in this field, so that every day I go to work, I don't feel like I'm working. You know, I feel like I'm really making a difference, not only in the population for us, for our African American individuals or for our women individuals, but for just every young person that is concerned about their health and wanting to get on the nose, on the inside scoop on what's going on with our medications without having to hear it from false news or social media. And I will say it's been very rewarding. I love what I do, and I do think that we need more we need more healthcare professionals that have a passion for learning and have a passion for teaching other people, and don't have a malicious intent behind it.